Welcome to SCF's Radiography Program information session. The intent of this information session is to help you gather important information to allow you to make an educated choice about future career. Next, I'd like to introduce myself and then the program faculty. So my name is Patrick Patterson and I'm the Radiography Program Director.
Hi, I'm Madeline McAuliffe. I'm the program's clinical coordinator.
Hi, I'm Alicia Salerno. I'm one of the clinical instructors for the Radiography Program.
Hi, I'm Christine Weinglass. I am one of the clinical instructors for the Radiography Program.
As we begin the information session, it's important to realize that radiography is a profession. And a profession has certain characteristics associated with it that are not associated with non-professional jobs. Certain individuals will have certain expectations from you. Who are these individuals? Well, the patient. The patient will be expecting that you'll be knowledgeable and you'll know how to take an x-ray. The general public will have certain expectations. An example of this would be as you enter into the field and you become a radiographer, suddenly you're the expert in the field and your friends and family will come to you wanting information. So that would be expected that you would be able to share that with them. And then finally, the healthcare team. They're going to expect you to be operating as a professional, getting the best images possible, and working well with other healthcare providers. So what are these expectations that these individuals have? Well, they're going to be expecting you to be knowledgeable, to be caring, and to be trustworthy. In other words, you're being held to a higher standard. Just as an example, just think about it from a patient's point of view. This individual comes into a hospital who doesn't know you at all, and they share very intimate details of their life with you. For example, their health care, their injury, and they're going to let you touch them to position them for the radiographs. So having said that then, they're expecting you to be professional, as well as the profession is expecting you to be professional. So what are the characteristics of a profession? Well, the dictionary defines a profession as a job that requires special education, training, or skill. Another definition would be it's a calling requiring specialized knowledge and intensive academic preparation. So the underlying theme here is education, preparation, and skill. So let's look at some of the characteristics of a profession and as they apply to radiography. So a profession is based on theoretical knowledge. So there's a lot of research that's been done on the profession. So for example, radiography has been around since 1895 when it was discovered by Wilhelm Röntgen. And we have a lot of research done since that time. So there's definitely a theoretical knowledge base for radiology. To become a radiographer, there's an extensive period of education. We have the clinical component that goes with the 2-year period, and then also the classroom component. Testing of competence. So throughout the program, you will be tested on your competency to perform a radiographic procedure. This will continue throughout the 2 years. You're constantly being evaluated to check that you're gaining competence in the skills. At the end of the 2 years and after you graduate, you will need to take the National Registry exam to successfully practice in radiography. A profession is driven by a code of ethics, and our professional organization, the American Society of Radiologic Technologists, has a code of ethics that we'll be looking at in just a minute. Another characteristic of a profession is that it's mobile. So once you are credentialed in the area, you can take your job and pretty much work anywhere in the United States. There's reciprocity between the states with your license, so you're able to work in different facilities. And a profession usually has a continuing education component associated with it. And that is to make sure that the people, the technologists, stay up on their knowledge, that after they graduate from school, they just don't stop learning. Because the technology is constantly changing, so this assures that you take time to learn the changes and that you stay current in the profession. Our profession does have a requirement for continuing education before you can renew your license each year. So here is the code of ethics that have been developed by the American Society of Radiologic Technologists, the professional organization of radiologic technologists. So as you can see, there are certain expectations. You can take a look at those, but just kind of some of the highlights that I think are important is the radiologic technologist conducts him or herself in a professional manner, responding to patient needs. So when a patient is in your care, it's very important that you provide appropriate patient care to the patient so they get the best quality care that they can get. If we take a look at number 3, the radiologic technologist delivers patient care and service unrestricted by concerns of personal attributes. That simply means even though you may not like the way your patient looks or their nationality, you must still provide the same quality of care that you provide to everybody else. Number 4 states that the radiologic technologist will practice technology founded upon theoretical knowledge. So that's just saying that you will work ethically and based on the theories associated with radiologic technology. Item number 5 speaks to the idea of you're going to assess situations and use critical thinking skills. One of the things that is very unique about radiology is that every patient is different. Every exam is going to be different. So that presents a challenge, but that's also kind of the exciting aspect of radiologic technology. Number 6 speaks to the idea of you are the liaison between the patient and the radiologist. So as you care for your patient, you will get a history and then give that to the radiologist to help in the interpretation of the images. Item number 7 regards the idea of producing x-rays using the minimal amount of radiation exposure to the patient. And then I just want to call your attention to number 10, which basically speaks to the idea of the continuing education that we talked about. So by having that continuing education, you will maintain your competence. Okay, so that's the code of ethics. So what's all involved with this profession? So as a radiographer, you're going to come in contact with various types of patients, doctors and nurses. When dealing with the patients, you are going to run into individuals with very different personalities. The other thing you have to remember is these patients are ill, so they may not be as cooperative as you would expect them to be. You also may be radiographing patients who have been in serious car accidents and sustained trauma, so you have to monitor your patient while you're taking the radiographs. And also you may interact with a dying patient. So all of these things then require appropriate skills to work with all the various types of patients you're going to encounter. You will also be working very closely with doctors, namely the radiologist, who is the physician who interprets the radiographs. You'll be expected to be professional around them and use appropriate terminology so that you can relate patient information back to the radiologist. And finally, you'll be working with the rest of the healthcare team that will also have expectations from you of being professional. Next, let's take a look at the day of a life of a radiographer and then a student. Probably the best word that summarizes a day in the life of a radiographer would be variety. And by that I mean you really never know what exam is going to be next, and that's what I find exciting about radiology. You may have at 1 minute be just taking a chest x-ray on a patient who is an outpatient and everything is fine, and the next minute you might find yourself over in the emergency room taking radiographs on a severely injured patient who've just undergone some sort of motor vehicle accident. We work everywhere in the hospital, as we'll find out a little bit later, but we're expected to go to the emergency room, the operating room, intensive care units. And so this variety is what makes, I think, a radiographer's life exciting. Additionally, with the variety comes critical thinking skills. So during your 2 years as a radiology student, you're going to learn how to position for all of the different types of exams that can be ordered. And you just have to apply your knowledge to get then all these different procedures that can come in. So that makes the day go fast, and it makes also for a challenge, because it may be a while since you've done a certain procedure, but you must retain it to be able to do it basically at the drop of a hat. Now let's take a look at a day in the life of a student radiographer. So at this point, I would like to describe to you how the program is laid out and what you can expect as a student radiographer. How does the learning process take place? So we begin by teaching you the theory, okay? For example, let's take the chest x-ray. You'll first learn about the theory behind it in the classroom. You'll learn the specific anatomy you need. You will learn how to position the x-ray equipment, and you'll learn how to position your patient for the chest radiograph, which, for example, is what you see in the upper left-hand corner of your screen. Okay, so then after you're taught it in the classroom, then you begin to use those skills and you can practice in the laboratory. On the campus, we do have 2 x-ray labs that have completely energized laboratories that allow you to practice. Even though they're energized, that means they do give off x-rays. You would never expose another person, okay? They're energized for us to do physics experiments and things like that. Once you then are in the laboratory, you get to practice and positioning on each other, so you get comfortable going through these motions as you learn to take a chest x-ray. Then you will be evaluated in the laboratory through a process called simulation. You will conduct a chest x-ray procedure as realistically as possible. We have volunteers who serve as patients, and you'll position them for the chest x-ray. It will be just like you were doing it on a real patient. While you're performing the simulation, you're going to be evaluated by a faculty member. And if you successfully complete the simulation, that then means that you can go ahead and start to practice this out in the clinics and move on to the next step. So what is that next step? Well, at this point, you've been given the knowledge, you've practiced, and then you're going to be out in the hospitals and the clinics and actually working on patients and taking various exams. So again, our example is the chest x-ray. So one little more word about how the program is laid out. So on Monday, Wednesday, and Friday, you are on campus, either in the classroom or the laboratory. And then on Tuesday and Thursday, you are out in the hospitals or clinics that you're assigned to. It provides for a very interesting educational experience because on Monday and Wednesday and Friday, you're practicing on the campus. And then on Tuesday and Thursday, the next days, you're actually out there utilizing what you just learned and performing a chest x-ray, for example, on a real patient. Now, how that occurs in the clinic is you will be under the direct supervision of a registered technologist at all times until you become much more confident. And how do we know when you've reached that competency level? Well, once you've done several chest x-rays and you're feeling pretty confident in your positioning skills and with the whole procedure, then you have to complete what's referred to as a competency exam. And what happens during a competency exam is the radiologic technologist will watch you perform the procedure with no assistance from the technologist. You're on your own, but you're being directly supervised. If you successfully complete the procedure, then you receive a status of a passed competency. And once the competency is passed, then you can start to complete those procedures in the future without direct supervision. Until you prove competence, you are under direct supervision at all times. So this is how the program is laid out. So you will learn it in the classroom, practice in the laboratory, and then go out in the clinics and fine-tune these skills. And once you have the confidence level, then you will go up to your clinical instructor and request that you want to do a competency procedure on the chest x-ray. If you successfully complete that, then your supervision level drops off, and now you're becoming a little more independent. And this will happen throughout the whole 2 years as you learn all the different procedures. You have to prove competency in all these procedures before you may graduate. So that's kind of an overview of what's going to occur when you're a student in the radiography program. Now let's hear a word from some students who are currently enrolled in the program. What better resource to learn about what it's like to be a student radiographer than to listen to a radiographer. So at this point now we're going to have a little video.
Now we're going to get some information from 2 students that are currently in the program. They're second-year students. We have Megan and we have Grace over here. They have 2 more semesters to go. So was there anything that surprised you when you started your clinical rotations that you didn't know after attending the information sessions and the orientation of the program?
I didn't realize that OR was going to be such a big part of the program. When you go out to clinic, you go in and there's lots of surgeries that you're part of where you use the C-arm. There's going to be in-house in your department area where they're going to do fluoroscopy procedures. That was all pretty new to me.
For me, I didn't really know how hands-on it would be in the clinical aspect of things, but I was surprised at how willing the techs were in the hospital to let you do the exams on your own and jump right in and doing the exams on your first day.
Okay. Next question. How much time do you spend studying a week, and how do you balance school, clinic, and your personal life?
I study at least 30 hours a week. Depending on if there's a test, it could be more. To balance my personal life, I have a fiance and a 6-year-old daughter, and trying to work in studying and spending time with them is pretty difficult. You have to make sure that you set aside a little bit of time, probably on the weekends is when it's the reality, to put in that time to do things like that.
For me, I spend about 30 hours a week studying as well, and I agree it's kind of depending on what you have going on for school. If you have a test, it could be more. But as far as balancing personal life and work and the program, I have a husband, I don't have kids, but I do still find it difficult to balance that and juggle everything. But my advice would to take at least 1 day a week, and if not a whole day, take at least half a day. I usually take Saturday morning to study, as well as Monday through Friday and Sunday. But then my advice would be take part of a day. So I usually take part of Saturday and I'll spend it with my husband and I'll spend it with my family. And you still have to do the things you love. You just have to find a way to balance everything. And what works for me may not work for you. What works for Megan may not work for me or you. You know, everybody looks different. It just kind of depends what your personal life looks like, and you have to find what works for you.
Okay, next question. Were you surprised by the amount and depth of the information taught in the class? Is there anything you found surprising that's taught that you didn't think you'd have to learn?
For me, I was surprised at not only knowing every bone in the body, but you have to know every part of the bone, every aspect, and what it looks like from different angles. In the physics part of the program, you have to learn how the X-ray tube works and all the circuitry that goes within that. There's a lot of science involved with that.
For me, the physics really surprised me, everything that you had to know as far as physics went. But it really does have a lot to do with the program. At first, I was kind of wondering why we were learning about computers and the circuit and the transformers. But all of that has to do with how the X-ray tube works, and you're using that every day. And while a lot of it does sound really complicated, once you learn about it, and if you put the work in, those study hours in, it will make sense eventually. To me, it actually made more sense when we did get out into the clinical areas, and we got to see how the X-ray tube works, and all of that just kind of comes into play when you're in clinic.
And what were your expectations of patient contact before entering the program, and what were the realities of it?
When we practice sims in our lab and with the other students, the patients are able to move. After that, when you get into clinic, some of the patients move, but that's pretty few and far between. They're hurt or they're really sick. It takes a lot of people, if the patient's larger, to move them. So you have to kind of go get a team of people to transfer them onto the table. Sometimes you're helping the patient get up out of the wheelchair to get up on your X-ray table. And if they're heavy, then you need extra hands.
Yeah, I agree. I think the patient care aspect surprised me when I realized not every patient was going to be walking and smiling. Not every patient is like that. In fact, I would say most are not. A lot of the outpatients are, but there's inpatients, and they may be in bed, they may be out of it and not awake. They may have a bunch of tubes hooked up to them and are on life support that you have to get an X-ray. So that part of the patient care did surprise me a little bit, that not all patients are going to be walking and happy. Some may be hurt, some may not be able to walk, and you do have to be there to help them.
How much interaction do you have as a radiographer with physicians, radiologists, and members of the healthcare team?
You interact with everybody. The doctor, especially when you're in surgery, the whole healthcare team kind of works as a whole. When you go down to the ER, you have to make sure you check with the nurse that you can take the patient, kind of check on their condition. The radiologist is when you're working in the department and they want to see images, or if you do invasive procedures like Grace was saying before, you all work together.
I kind of like to look at it as like the healthcare team is one body, just different parts. So if you think of like your legs, your feet, your arms, your hands, they all have different things that they're doing, but they're a part of one body. So that's kind of like the healthcare team, like the nurses, the doctors, the radiologist. You really get to work with a lot of them, and everyone has their part of what they're doing for the patient. So I would agree for the OR, you're working a lot with the surgeon. You will learn to read people's mind because you have to follow their instruction. As far as the radiologist, you work a lot with them in fluoro exams.
Did that kind of surprise you both when you went to clinic, how much you're part of that healthcare team?
Yes.
Yeah.
Yes.
How has the program affected your life positively or negatively?
I think positively. I'm very proud of all the learning I've done and how well I'm doing in the program. It's a lot of fun, and I didn't really know a whole lot about it prior. So to be in the medical field and to be part of it is very rewarding. You're going to make some sacrifices with your extra time. There's not going to be a whole lot of that. Like Grace was saying, if you take a little bit of time each weekend or something like that, you'll kind of refresh and reset and have a good week after that.
I would agree. It definitely comes with sacrifices, but it is very rewarding and it's worth it. So, I mean, I'll keep saying this, if you put the work in, like, you can do it, but it will come with changes in your life. It may be to your personal life. You may not be able to go out and do as fun things, but it is so worth it in the end. And to be able to look, like, we have 2 semesters left, and it's rewarding to see how far we've come and how much we've learned throughout the program. So I would say it's affected my life positively. And if you love learning, then you'll love the program.
And what is one piece of information you wish someone would have told you before you entered the program?
Probably that you're going to be giving up a lot of your life for this, but the reward really pays off. I think the patient care is probably one of the most rewarding pieces of it. Just they're depending on you to take care of them and to listen sometimes is probably what I find there.
So the one thing that people did tell me was to quit your job. And I did not do that right away. So I would say, I mean, it's definitely possible to be in the program and work. But if you think that you can get in the program and work your full-time job, I feel like you would have to be a genius, because that just, I mean, for me personally, that was not possible. My first summer semester, I was working 35 hours plus doing the summer semester online because of COVID. And while I did okay, come fall semester, we were in clinic and doing classes. Working just was not an option. So I had to go down to 20 hours a week. And then after that semester, I mean, my hours just kept going down because it was so much to handle. So the one thing that people did tell me was, stop working as much, because this does require a lot of time. So if you look at the program as your full-time job, because it is, I mean, we've both said that we take 30 hours a week just studying, but that's not including the classwork, that's not including the clinical hours. So if you think about it, it's really more than a full-time program.
Okay, one more question. Has COVID affected your clinical experience at all? What impact has it had?
For me, with COVID, being in the hospitals, you're around it a lot. the amount of patients that I've seen in the hospital that do have it, you're not contacting them all the time with the ones that are known, but you are always wearing a mask when you're in clinic, and if they know that they are COVID positive, you're wearing a mask, gloves, gowns, so you're pretty much protected in that aspect. So it hasn't really been something that I've been super concerned about, because we are taking the proper precautions to protect ourselves.
I would agree with that. COVID has definitely impacted the clinical experience, but the hospitals are taking the right precautions, and because of that, I didn't really have a fear going into clinic because you have the mask and you had the face shield. Some hospitals are still using that, some are not. But either way, they are all taking the right precautions to keep us safe, to keep themselves safe, and to keep the patient safe. So I would say it has affected it, but you're still being protected by the right PPE gear and you're still safe.
I hope you found the student interviews interesting and informative. Hopefully it answered any questions you might have regarding what it is like to be a student enrolled in the program. Now we will continue our discussion about other various aspects of the program.
So what's involved with this profession? So where do we work? As an x-ray tech and a student, we work all over the hospitals. We work in the OR room, the operating room. We work in the ER. We work in an outpatient setting, and we also work in the main department that's located in the hospital. Every area is and can be very different from one another, even though they may be under the same roof. In the operating room, the only way that the doctor can tell if they're putting in the hardware correctly is if we go in there with our x-rays to see. In the ER, we're usually frontline, ready to go. When the patient gets brought in for a trauma or a car accident, we are usually there to take our x-rays so that the patients are assessed and are able to figure out what it is that is going on, as well as the doctors and nurses. And in the outpatient facilities, what we usually do is just routine x-rays. Most of those patients that come in are very easy. They like to walk in, they want to get in, want to get out quickly. So we have to learn to be quick, and we have to learn to be efficient as well. And then in the main department, we get patients from the floor. If they're too sick to come down to see us for an x-ray, we can always go up there to see them with our portable machine. So we are all over the place in the hospital and continue to be very much needed. So what do you need to bring to the table? Verbal communication skills. When we are in the healthcare, we have to talk to our patients. And sometimes not only do we have to talk to our patients, but we have to talk to our patients' family members and doctors and nurses and other techs. So we need to bring verbal communication skills. We also need to bring written communication skills. We have to write and document the histories of our patients correctly so that the radiologist, when he reads our images, he's able to determine why the patient was there and for what reason. So history is very important. We are kind of the mediator between the patient and the doctor. So knowing how to write correctly, knowing how to correctly abbreviate medical terms is very, very important. So that's something that you will be taught in the program your very first semester during the summer. You also need to bring ambition and tenacity. Have the drive. You have to be persistent. You have to be motivated to practice in this field. During the 2 years, this is an interview process, so when we go out to the clinical sites, they want to see motivation, they want to see interest, because that's going to stick with them and they understand that you are involved in this program. We have a lot of students who choose not to be very motivated or maybe are too shy and it may come off as not being motivated. But we encourage you to get involved in all exams, all the time, hands-on. It's the only way that you're going to be able to learn and then to take that out to clinic and actually do on real patients.
As you are learning more about the program, a question that may come to your mind is, what are my opportunities after I graduate? Well, after you graduate from the program, you will receive an Associate of Science degree. That will make you eligible to take the National Certification Exam. When you successfully complete that exam, you will be given the credentials of a registered technologist. And with those credentials, you can work in a department at a clinic or in a department in a hospital. And many people are just happy to do that. But some people wish to pursue their education. And what are the avenues for that? Well, you can receive a Bachelor's of Science degree in radiologic technology. And this may allow you to maybe move up within a radiology department. So you may start as a staff technologist, and if you have a bachelor's degree, you may find yourself qualified to move up to or be promoted to maybe a supervisory role within the department. Some individuals may wish to go on and become an administrator of a radiology department. That usually requires a master's degree, usually an MBA. Some individuals may wish to pursue their education and become a radiologic technology program director. That would require a master's degree as well. And finally, some individuals may wish to pursue a PhD. And those people who do that, if you're pursuing a PhD in radiologic technology, those are the ones that usually end up doing the research. Remember, I said earlier that a profession is based on theoretical knowledge, and individuals with a PhD in the field generally do a lot of research to help promote the field of radiologic technology and radiology. So many options. I like to say that graduating from an X-ray program is really just the beginning. It gets your foot into the door to allow you to do many more things. If you are watching this presentation, you are interested in the field of radiologic technology and most likely are investigating other radiography programs. If there's one thing to remember from this presentation, it is that you need to make sure that the program you're going to attend is accredited. There are two main reasons why this is important. When a program is accredited, it assures that you are being taught the information you need to be a successful radiographer. And secondly, in order to be able to be eligible to take the national certification exam, you must graduate from an accredited program. The accreditation agency that accredits radiography programs is known as the Joint Review Committee on Education in Radiologic Technology, the JRC-ERT. What their job is to do is to make sure that the program has met the standards that this organization has set. Now, there are many radiography programs in the country, approximately 650 of them. They can all be developed and designed differently. However, they all must share the same curriculum. And the curriculum is developed by the American Society of Radiologic Technologists, which is our professional organization. And you can see their logo at the bottom left side of the screen. They develop and provide the curriculum for programs across the country. The JRC then evaluates the programs to assure that you are teaching the proper curriculum. So when your program is accredited, you can be fairly confident that you're getting a good education. The radiography program at the State College of Florida is fully accredited, and during the last site visit, we were granted the full accreditation of 8 years. Some other organizations I'd like to talk about since we're on this page is the American Registry of Radiologic Technologists. So you see their logo in the middle, the ART. This agency is responsible for administering the national certification exam. This is the one that you must pass to become registered so that you can work in the profession. Finally, the Florida Department of Health is the agency in the state that then issues a license so that you can work in the state of Florida. What does that mean? Generally, if you pass the national licensure exam from the ART, you are granted then a license. They have reciprocity with the American Registry of Radiologic Technologists. So you don't have to take an additional test, you pay a fee, and then you receive your state of Florida license. So these different organizations are very important to the field. They all have very different functions, but they all work together to provide you with the best possible education that you could get. So again, as you investigate other programs, make sure that the program is fully accredited by the JRC.
Okay, so what are all my options once I become a registered technologist? The beauty of this profession is that you can cross-train into other imaging modalities. A lot of the times, too, facilities will cross-train their registered techs into CAT scan or CT, MRI, bone density, mammography, or even angiography. This is something that you don't have to go to extra schooling for. They usually will do it on the job training. And then at the end, after you've had the acquired hours, you will sit for another registry in that modality and be certified. Additional teaching or additional schooling would be something like nuclear medicine, ultrasound, radiation therapy, and that's something that as a radiologist, or I'm sorry, as a radiographer, you cannot just cross-train into those modalities. So those require extra schooling, extra training outside of this profession. So when asked what are some of the rigors of the program, if you ask a student, they will definitely agree to this little caption here, that they feel stressed day and night. A lot of times, students who come into this profession have never had any kind of medical background. They've never even stepped foot into the hospital. So that alone is very intimidating and very nerve-wracking and stressful, on top of adding classes to this profession that, you know, correlate with what we're doing. So classes and clinicals are pretty rigorous. As a first-year student, once you're in the program, you will be going to clinics starting in the fall on Tuesdays and Thursdays, and then you will be in classes on Monday, Wednesdays, and Fridays. As a second-year student, that will begin in the second summer of your program. You will then go to clinic in the fall, Monday, Wednesday, Friday, and then go to classes on Tuesdays and Thursdays. So your schedule is a 5-day schedule, regardless if it's in clinic or in class. Both will have to be done. But the students really do like that, with all things considered, because what they are taught maybe one day, on Monday, they get to go to clinic and apply it. So it really puts the two hand in hand, and it really kind of encourages them to go in and want to do these things. Study time compared to practice time. Studying is one thing, practicing is another. You will be taught how to position for certain exams, and it is to your best benefit to stay after classes and go back into our 2 labs and just start practicing with each other. Meaning, position each other. Get the tube and equipment where it needs to be, so when you go out to clinic, you know what you're doing. Study time. This is something that you can't just study in short-term memory. You have to retain this for the 2 years, because then at the end you're going to be required to take a registry. So to study, you have to learn the material. You can't just memorize it for testing. So it's very, very important, because you don't want to be behind right off the bat if you're just memorizing. Everything will build on itself as the semesters continue. So what you didn't grasp maybe in the first semester, you're not going to really know then in the next semester. So we have an open door policy, faculty and I, and we will be more than happy to discuss anything with you, go over something that maybe you don't understand, and better to address it sooner rather than later. The pressure of being watched in this program is something that a lot of students have to get time to get used to. Not only are you going to be watched and evaluated during classes when we do simulations, you will also be watched very closely out in clinic, and then you will have to be under that pressure, or under those eyes of being watched step by step, so we don't injure our patients. And that just comes with the territory. You know, we're not going to set you free off in the clinic and not knowing what to do. As scary as that sounds, you eventually will get to that point. However, at the beginning and as you progress, you will be watched closely so nothing goes wrong. A lot of students kind of get intimidated by that, get very nervous, but that's just part of the program in any health sciences, and it'll eventually become non-noticeable, especially once you start improving your skills and getting more comfortable. Some of the physical aspects of the program are lifting. Sometimes we have to lift our patients up out of wheelchairs or slide our patients over from a stretcher to our table. So sometimes that could be very draining and hard on your body. Also standing. If you're not used to standing for 8 hours a day, you know, that could be very, very hard on you too. So we do a CNA program. So it's going to teach you proper body mechanics, how to move patients so you don't hurt yourself as well as the patient. And so we do give you those proper mechanics to use when you're out in clinic. And then some students are going to be visual learners, some are going to be kinesthetic learners. So sometimes you just have to figure out what kind of a learner you are, and this program is definitely going to be able to define that for you. Some people can read in a book and know exactly what it is that they're reading and have it retained and memorized, and they can just spit it out on a test and be able to apply it. I'm not like that, and most people aren't. However, they may struggle with the whole face-to-face interaction or the kinesthetic, the touching of the patient. They may struggle. Or maybe you are a better learner that way and not so much as a visual learner where you have to read it. So it's going to take a little bit of both in order, I feel, to do well. But whatever you're weak in, one or the other, you can always work on that, and it will come with time. Acceptance into the program. So we usually accept 17 students. And the reason why we only have a limited number amount is because of the limited facilities that we have. Each facility can only take and hold so many students at a time. So with that, we can only accept so many students at a time. We do go to hospitals. We go to an orthopedic clinic. We go to a children's orthopedic and scoliosis clinic, outpatient clinics, and other hospitals. Some of the hospitals that we do rotate our students through is Venice Hospital, Doctors Hospital, Lakewood Ranch, Manatee Memorial, Blake Hospital, and South Bay Hospital up in Sun City. We do go up to Tampa as a second-year student for coastal orthopedics, spine and scoliosis, and we also go to coastal orthopedics, which is an orthopedic clinic here in Bradenton. We also rotate our students to another outpatient called Manatee Diagnostic Center, and so you get that whole perspective of an outpatient type of patient. Like I said earlier, each patient's going to require different things and have different needs, so that's why we rotate you. Now, not everybody is going to all of those clinics at a time, but everybody will be required to go to Blake Hospital, Manatee Diagnostic Center, and then Manatee Memorial Hospital. Those are our three main hospitals that we always rotate all of our students through, as well as COSA, which is the Children's Orthopedic Spine and Specialist. This will start that summer. So application deadline is usually the end of January, so you want to make sure that you get all your paperwork in to the secretary and make sure that everything is turned in appropriately. Usually Pat and Madeline will go over the applications, and then usually we'll make a decision sometime in March, usually by spring break. So be waiting to hear through email, through your SCF email, whether or not you've been accepted. Like I said, with the 17 that we accept, if you are one of those 17, you need to let us know that you have accepted that position so we can go on with the other things that need to be done prior to starting the semester in summer. Again, it's rigorous, but it's exciting, and it's just 2 years out of your life that just kind of is well worth it after everything has been said and done. We are proud to announce that everybody who's graduated has a 100% pass rate, so that makes us very proud and makes us think that we're doing what we need to do to successfully get you guys ready to be released out into the field. The other nice thing that I like about this is that once you've graduated our program, all of our students have been hired into the field, and so that's great too, to know that they are comfortable with hiring our graduates and that they know that they're going to do a good job. So what can your career offer you? So flexibility with hours. If you don't want to work into a hospital, you have the option to work at an outpatient or an orthopedic clinic. If you're not a morning type of person, they have second shifts and third shifts in the hospital as well. And with that comes a higher pay raise. You get time and a half. So some people like that option as well. If you're one that wants their weekends free, outpatient settings are the way to go for the most part. Salaries for this job is pretty nice. Usually it's anywhere between $23 and $25 an hour, give or take, roughly about $47,000 to $49,000 with benefits a year. One thing that I like and it can take to heart is the personal satisfaction of helping others. especially when they're not feeling well, they hurt. Those few minutes that we're with them to help them get a diagnosis to make them better. You know, a lot of times, unfortunately, nowadays, everybody seems to get pushed through as a number, but if I can get that patient a nice warm blanket, because maybe they felt that nobody was listening to them, to get them a blanket, you know, that's what we're here for, to helping the whole process and getting them helped and cured for whatever they are in there for. And just the job outlook. It's been nice to know that, fortunately, knock on wood, that our job outlook is pretty good, especially in this area. Again, we rotate you guys through enough hospitals that word of mouth gets around, and so they are eager to hire our grads. So there have been times when we've had students apply for a position and there's not one open, so maybe they make one just to get that student into their facility. So that's a nice thing. And I feel like it's a good motivator to do your best when you're in the program for the 2 years.
That concludes the information session. I hope you found it interesting and informative. To verify your attendance at the information session, please click on the QR code in the upper right-hand corner of the screen. After you scan the code, you will be taken to the attendance verification sheet. Please provide the required information to verify your attendance. After you receive your information, you will be emailed a certificate of attendance, which you will need to submit with your application. You will also have an opportunity to ask questions that you still may have after attending the information session. Thanks again for attending SCF's Radiography Program information session.